Dr. Hussein, you work as a clinical enroller. So I would like to share part of that experience. And I would also like to ask, and this is maybe a question for all of us, what are people afraid when they have some concerns about the vaccines? By the way, what are they afraid of? What are they thinking is going to happen?
Yeah, so a lot of these questions came up originally when I was doing the treatment and prophylaxis trials and kind of before we even got into this vaccine realm. But I think one of the things we already highlighted was the fact that people were afraid of just kind of the speed and the creation and all of that, which I think everyone covered really well. And I think the other concern is the fact that, we frame this thought process that the people have a lot of mistrust in the health field and the healthcare and medicine and all of that. But I think by framing it as mistrust, we are putting the onus on people when the onus should really be on the healthcare system. As a healthcare system, we have been untrustworthy in the past. And so we are not always deserving of that trust. And I think that is the thing that we have to break down. And we have to really take that onus as a medical field and figure out how we can breach those gaps that we ourselves created by doing things in the past that were incorrect and unethical and so forth. So I think that's one thing. So I like to frame it in that sense. But two, people are worried about side effects, like what is going to happen to me if I get a vaccine? And I want to point out that vaccines are basically the safest intervention that we consider because it is something we give to healthy people, right? Like you don't already have a problem. We're not treating something that has occurred. We are trying to prevent something from occurring. So from that standpoint, we find vaccines really safe. And most effects that you see from vaccines are going to be in that early period of 1 to 2 weeks or 3 weeks. The fact that these trials have been following people for 2 to 3 months now, if you are counting Moderna and Pfizer, the likelihood that you're going to have a significant adverse effect after that 3-month period is really low. That being said, because we're not 100% sure of anything, as I'm sure everyone has realized during the pandemic, that science changes consistently because we are working and progressing towards truth and towards what actually works, is that we are still going to follow up people for 2 years to see what the effect of those vaccines are. Now, we won't have a group that wasn't vaccinated because at this point it's unethical to not offer a vaccine that is available if you become, eligible to get it. But we will see the effect of these vaccines that we are doing and watching it for a long period of time. And so I think that is a lot of the concern that people tend to have. I think that was mainly it. I also already lost track of the question, but I think it was about safety. So, and what my patients were concerned about, but that was basically it. Basically safety. Do they trust what's being given? Is it actually going to help them? And I think the other common thing I heard was, well, why do I need a vaccine for a disease that doesn't kill that many people? And if you get it and you're fine, why do you need to be vaccinated? And my answer to that is that we know that you may have partial immunity for about a 3-month period. That's what our studies have shown us so far, once you get the infection yourself, but that's about it, right? And we want long-term immunity. Now, granted, we don't know 100% how long immunity from these vaccines will be, but most things that we have vaccines for can last for years. Sometimes you need a booster, sometimes you don't need anything. And so we feel that these vaccines are going to give you that longer immunity, and we want everyone to get them regardless of whether you had COVID or not. There is always the option, if you were recently infected, to wait 3 months because you're kind of protected those 3 months, right? To allow for other people who have no immunity to get a vaccine, not because of a safety concern. So even if you have COVID, we haven't seen any people have issues with getting the vaccine despite the prior infection. So just some things.
Perfect.